How does Medicare cover cataract surgery? This is a question we often get in our office. My name is Christian Brindle. I'm a licensed insurance agent specializing in Medicare health plans. I'm also the owner and the operator of Christian Brindle Insurance Services, our insurance agency, also known as Everything Senior Insurance. And cataract surgery is an interesting one because one thing you hear commonly about Medicare is that Medicare on its own, without some kind of Medicare Advantage plan that pairs with it, or without some kind of standalone dental, vision, and hearing plan, does not cover vision coverage. So how does cataract surgery relate to that, right? Because cataract has to do with your eyes, right? Technically, that's vision, is it not? Well, in the eyes of Medicare, cataract surgery is actually a separate charge, and I'll explain how this works. In the eyes of Medicare, you have what's known as medical vision and just vision. So just vision would be for things that are for things to help you see better, right? More elective, not medically necessary things in the eyes of Medicare. This could be a new pair of glasses, right? You just go in for your prescription, you get a routine eye exam and get a new pair of glasses to better fit your eyesight at this current point in time. That in the eyes of Medicare is vision coverage and is not covered. It's considered elective in the eyes of Medicare. Okay. Now, cataract surgery, not just cataract surgery, but cataract surgery, glaucoma treatment, macular degeneration treatment, anything of that nature is considered with having to do with a disease or a sickness in your eye. And that is medically necessary. So it's not even necessarily looked at as vision coverage. It's looked at as medical coverage. And it falls under, in most cases, Medicare Part B coverage. So if you have a Medicare supplement plan, the way this typically works is Medicare is your primary payee, pays 80% of those charges. Your Medicare supplement oftentimes will come through and pay 20% of those charges. You might have a little bit of out-of-pocket left over, maybe a couple of $100s, depending on the actual Medicare supplement plan that you obtain. But that's usually all you're going to pay. You'll either pay zero out of pocket with a Medicare supplement or maybe a few $100s depending on your plan, depending on how much you've used it over the course of the year. The Medicare Advantage side of things, because you could have a Medicare Advantage plan, depending on the area that you live in, depending on your zip code and the exact plan that you go with, you're probably looking at $100, $200, $300, maybe as much as $400 out of pocket for a same-day surgery, and usually cataract surgery is a same-day surgery. So to get that point across, it's not very expensive under Medicare. Regardless of if you have a Medicare supplement plan or a Medicare Advantage plan, in most cases, you're probably looking at a few $100 out of pocket for the cataract surgery. And it's covered and it's medically necessary. It's not considered vision. Sometimes people get that confused when they hear that Medicare does not cover vision coverage. But things like macular degeneration, glaucoma, cataracts, those things are medically necessary in the eyes of Medicare, and they are covered under medical, not vision. Anyway, I hope this video was helpful, educational. I hope it answered your question that you clicked on wanting to answer when you first started watching this video. Make sure to do us a favor if you found this video helpful and you watched all the way to the end. Make sure to smash that like button for the YouTube algorithm. It's going to help so many more people on Medicare like you find this information who desperately need these answers. Comment your thoughts down below on videos you'd like to hear us talk about in future videos, and also comment your thoughts on the topic of this video. We'd love to have a dialogue with you. Make sure to subscribe. We put out weekly informational videos that help you understand more about your Medicare benefits and how to utilize them. We appreciate you watching all the way to the end, and we'll see you next time, everybody. Happy Medicaring!